DOLA patient-ready orthotics. The orthotics podiatrists use. A collection of our 9 most popular and proven prescriptions developed from over 50 years of clinical and orthotic experience. Patient-specific styles, ready to fit in clinic, orthotics for health professionals only. The Supination patient-ready orthotic combines the cushioning, contour, and lateral support the supinated foot needs. This video will help you identify which of your patients will benefit from adding the supination orthotic to their treatment plan. What type of foot will it help? What does it look like and how does it function? What conditions will it help? And why will this patient-ready orthotic help your patients? The supinated foot is a complex presentation, often displaying a combination of pathomechanical function in the frontal, sagittal, and transverse planes. From the posterior view, this foot may present with the calcaneus trending from a vertical to an inverted position in the frontal plane, more convex malleolar curves, and toes visible more medially. From the medial view, the foot may present with a higher medial longitudinal arch, with the talar head palpable more laterally than medially. From the medial oblique view, the talonavicular region may appear more concave or hollow. Using plantar pressure analysis, this foot may present with a reduced plantar surface contact area and high heel and forefoot pressures. During sagittal plane function in gait, due to the more rigid foot structure and the lack of rear foot eversion, the supinated foot may present with poor shock absorption, leading to compensation in the proximal chain at the ankle, knee, and hip. Another common presentation of this foot type is a sagittal plane block at the ankle, or an ankle equinus, which is a decreased range of motion due to tightening of the posterior structures, including the gastroc or soleus. During foot loading from heel strike to mid-stance, the foot may also present with lateral instability as seen by overactive perineals, prolonged loading of the lateral foot, and maintenance of a lateral toe-off pattern. The lateral toe-off pattern, or low gear toe-off pattern, is a sign of impaired propulsion and may also result in proximal compensations. On examination of the forefoot, the supinated foot can also present with several features. They include an adducted forefoot, a forefoot valgus, a plantarflex first metatarsal, or a forefoot equinus. A supinated foot can also present with many mistimed gait events. They can include the previously mentioned poor shock absorption, prolonged lateral loading, a low gear or lateral toe-off, an impaired propulsion and windlass mechanism. Your patient may present to your clinic with many pathologies relating to their foot posture and function, including various forefoot pathologies, including skin changes or hyperkeratosis, general metatarsalgia, metatarsal capsulitis, bursitis, neuritis, or neuroma, all relating to the high loading and high forefoot pressures and impaired forefoot function, especially during propulsion or toe-off. First MPJ pathologies are also common, including bunions or HAV, and the development of hallux limitus and sesamoiditis, all relating to forefoot loading, function, and instability. Toe deformities may also be a sign of impaired forefoot function, including plantar plate injury, claw toes, or retracted toes due to muscular imbalance. Arch and heel presentations are also common, including plantar heel pain, plantar fasciitis, Achilles pathologies, fat pad syndrome, and midfoot osteoarthritis, all relating to the foot loading and increased tissue stress demands. The lateral foot loading, lateral toe-off, and instability can all be related to presenting complaints including perineal pathologies, lateral foot pain, cuboid syndrome, and lateral ankle instability. Due to the proximal chain compensations previously mentioned and poor shock absorption, your patient may also present with common pathologies affecting the patella or patellofemoral joint, the knee joint, sacroiliac joint, and lower back. The signs may already be there in your current treatments, giving you confidence that the supination orthotic will help your patient. Have you had success with taping of the medial arch, lateral ankle or forefoot? A footwear change to a more cushioned style, stretching or strengthening program, improved capacity of the pathological tissue or treatment-directed testing of a lateral wedge, medial arch pad, lateral arch pad or heel raise? Or has your patient had previous insoles? All of these may indicate that the patient-ready supination orthotic will be a successful option. So how does the patient-ready supination orthotic help my patient? This orthotic design combines the cushioning, contour, and lateral support the supinated foot needs. Stable rear foot control. The rear foot platform provides stability for the transition from heel strike to mid stance during foot loading. The medial arch cushioning and contour provides improved shock absorption and contour to the higher medial arch, increasing the surface contact area. The lateral arch support stabilizes the foot and promotes medial transition into propulsion. The lateral wedge improves lateral stability and medial transition into propulsion. The moderate heel raise improves transition from mid-stance to propulsion and addresses the common sagittal plane characteristics, including an ankle or a forefoot equinus. The full-length performance EVA provides a combination of cushioning and control that this foot needs. And the luxury DuraFit top cover is designed for both daily and sporting activities. For more options to fix the feet that walk into your clinic every day, see the full patient-ready range and be sure to check out the rest of the training modules. Need help finding the right orthotic for your patient? Use our online orthotic selector tool. Tell us about your patient, their activity level, pathology or lifestyle and performance goals, their foot type, clinical test results, and we will recommend the best patient-ready orthotic from our range. For daily education and training, follow us on social media, including Facebook and Instagram. Subscribe to our YouTube channel, follow us on LinkedIn, or visit dollarorthotics.com.